And with me on the phone now is Dr. Philip Chan. He is the CEO of Cytosorbents Corporation. CTSO is their stock symbol. Dr. Chan, good to talk to you again.
Well, thanks, Don, for having me back on the show.
Well, tell us again what the company does.
Yeah, just to summarize, Cytosorbents is a critical care-focused medical device company using blood purification to treat life-threatening illnesses in the intensive care unit that cost millions of lives each year and billions of dollars worldwide. Our main product, Cytosorb, is a blood filter that is designed to remove toxic materials from the body that would otherwise lead to massive organ failure and death, diseases like sepsis, severe burn injury, trauma, lung injury, and pancreatitis. And it's now approved in the European Union and in other countries that accept CE mark approval. So we've officially launched the product several months ago in Germany, Austria, and Switzerland with a small direct sales force, and are working to expand our sales to other EU countries through partners and distributors. So the reception to our technology has been very strong, and we're now happy to announce that we have more than 40 key opinion leaders interested in using our technology.
Now, I know a lot has gone on since we last spoke. Why don't you bring us up to date?
Sure. Well, one of the key events was the award of a Phase 2 SBIR grant that's valued up to $1 million over 1 year. We're very excited to be working with the U.S. Army and now with interest from the U.S. Air Force as well. The U.S. Army is the group that is funding this SBIR grant. As I mentioned in our previous interview, our soldiers in the field face a wide variety of injuries like shrapnel and bullet wounds that get infected and can result in a deadly disease called sepsis. They also suffer from major trauma and explosions and collisions, and they also get serious burn injuries from fires and explosives. So this being said, this SBIR award will provide up to, again, $1 million of non-dilutive funding over the next year to help generate more data to support the use of our Cytosorb therapy clinically in both trauma and burn injury. Hopefully it will lead to a Phase 3 SBIR award where the technology will be evaluated in humans and basically help pave the way to an accelerated path for U.S. approval of Cytosorb in both trauma and burn injury. So with our $3.8 million DARPA contract that I spoke about to your viewers previously, and this U.S. Army Phase 2 award, we have now been granted approximately about $5 million in the past few months by two major agencies in the Department of Defense. The awards represent what we feel is very strong third-party validation of our technologies, and it will also further help expand our research and development efforts, which will in turn help increase our pipeline of products that we can monetize through our out-licensing efforts.
Well, Phil, that is remarkable. Now, I understand that you've also exhibited a great deal of confidence in your own company. You, as the CEO, went out in the open market, purchased shares in your company. We're almost out of time, but tell us about that.
Well, yeah. So I've invested in nearly every financing this company has done since I came on board in 2008, first as a board director and then as CEO. Most recently, I purchased 190,000 shares at 13 cents a share in the open market because I truly believe in our technology, our strategy, and our team. And so as a physician, there's really no greater reward for me than to participate as both the CEO of the company and as an individual investor to hopefully revolutionize critical care medicine with these technologies. So.
The company is Cytosorbents Corporation. CTSO is their stock symbol. Phil, congratulations on the accomplishments. Kudos to your purchase of your own company shares. Thanks for joining us.
Thanks so much, Don.
Take care.
Take care.